Today we are going to discuss about questions of Navodaya Vidyalaya Samiti Female Staff Nurse exam was held on 16th May of this month. There are 70 questions from nurses part. Today we are going to discuss about the nurses part of the exam, nursing part of the exam. First question, cerebral aqueduct passes through options midbrain, cerebrum, medulla and pons. Correct answer is midbrain. Second question, developmental task of old age according to Erikson is all except coping with the loss of loved ones, psychosocial conflict, achievement of ego integrity, modifying interpersonal relationship. Correct answer is coping with the loss of loved ones. Third question, metabolite excreted in urine in thiamine deficiency. Options xanthinic acid, figglue, pyruvate, glucose. Correct answer is xanthinic acid. If there is any faults in the answers I am telling, please comment. Next question, motivation theory which says that we are motivated to seek goals which gives us emotional feelings and avoids goal resulting in displeasure. Options opponent process theory, optimal level theory, drive theory, incentive theory. Correct answer is incentive theory. Next question, conflict between two positive goals is called. Options approach conflict, multiple approach avoidance conflict, avoidance conflict, approach avoidance conflict. Correct answer is approach conflict. Here is asking conflict between two positive goals, so approach conflict. Next question, which of the serum enzyme is elevated in rickets? In rickets, the enzyme elevated is alkaline phosphatase, ALP. Fourth option is the correct answer, alkaline phosphatase. Next question, in which part of respiratory system gaseous exchange take place? Gaseous exchange take place in alveoli. Next question, key enzyme that converts trypsinogen to trypsin is. Options elastase, enteropeptidase, secretin and chymotrypsin. Correct answer is enteropeptidase. Next question, what is the first step in providing first aid to casualty with a chemical burn in eye? Options shift the casualty to hospital. Shifting casualty to hospital is an emergency, but it is not the first aid. Next, apply an eye ointment immediately. It will not be done. Then third option, rinse the affected eye under running water. It will be the correct answer. Rinse affected eye under running water in chemical burn in eye. The eye should not be covered with a sterile pad in case of burns. So next question, 59th question's correct answer is rinse affected eye with under running water. Next question, mucopolysaccharide serves as a lubricant and shock absorbent in joints. Options dermatin sulfate, keratin sulfate, hyaluronic acid, heparin. Hyaluronic acid acts as lubricant and shock absorbent in joints. Next question, what should not do if you suspect sulfuric hydrochloric acid poisoning? In case of acid poisoning, we should not do what? Induce vomiting. Vomiting should not be induced in case of acid poisoning, because when acids coming in contact with the mucosal layer, it will cause burns to the mucosa. So action should not do is induce vomiting. Next question, which nursing intervention would be appropriate for a patient diagnosed with hypokalemia? Caution patient about eating food in potassium content, discuss calcium losing aspect of nicotine and alcohol use, encourage food and fluids with high sodium content, administer oral potassium supplements as ordered. In case of hypokalemia, we should do fourth option is correct. Administer oral potassium supplements as ordered. Next question. Nurse collected subjective data while doing patient assessment. Which of the condition nurse document? Here it is asking subjective data. So first option, patient is feeling nauseous. Temperature is 102 degree Fahrenheit. Patient ankles are swollen. Patient vomits after eating food. In subjective data, subjective feelings are telling. In objective data, observable findings are we are noting. So here, temperature 102 is an objective data. Ankles are swollen, it's also objective data. Patient vomit after eating food, it's also objective. Feeling nauseous, first option is correct. It is a subjective feeling, subjective data. Next question. In adult male, GFR, glomerular filtration rate averages options 180 ml per minute, 200 ml per minute, 105 ml per minute, 125 ml per minute. Correct option is fourth option, 125 ml per minute. A vertical plane that divides the body or an organ into right and left sides. Options, frontal plane, coronal plane, sagittal plane, transverse plane. Correct option is sagittal plane. Sagittal plane divide an organ into right and left side. Next question, which hormone decreases the level of calcium? Correct option is calcitonin. Calcitonin will decrease the level of calcium. Parathyroid hormone will increase the level of calcium. Next question, nitrogenous base not present in DNA. Correct answer is uracil. Uracil is present in RNA. Adenine, guanine, cytosine. These three are present in DNA. Next question, precursor for the synthesis of steroid hormone. Correct answer is cholesterol. Cholesterol is the precursor for the synthesis of steroid hormone. Next question, vitreous chamber of eyeball lies between. Vitreous chamber lies between lens and retina. Vitreous chamber of the eyeball lies between. Fourth option is correct. Lens and retina. Next question, depth of chest compression for adult during CPR. Correct option is 5 to 6 centimeter. 5 to 6 centimeter is the depth of chest compression for adult during CPR. Next is question, what you should do if someone is having epileptic fit? First option, give anything to drink. During epileptic fit, nothing should give for drinking. Aspiration will occur. Second option, open the mouth of the casualty forcefully to put something into mouth. That should not be done. Third option, lay down the casualty gently and clear the area around. This is the correct option. Lay down the casualty gently and clear the area around. And also we can give left side lying position to prevent aspiration. Next question, immunoglobulin present in most abundant quantity in human body. Correct answer is IgG. It is mostly present. IgG is mostly present in circulation. IgG also crosses placenta. Next question, a nurse on physical examination of patient find postural hypotension, tachycardia, nausea, vomiting and postural dizziness. In which electrolyte imbalance these symptoms can be diagnosed? Option first, hypokalemia. Second, hypocalcemia. Third, hyponatremia. Fourth, hypernatremia. Correct option is hypernatremia. In hypernatremia, we can see postural hypotension, tachycardia, vomiting, postural dizziness. Next question. Long cylindrical portion of the bone is called long cylindrical portion of bone. In bone, this long portion is called, these two are epiphyses. These two are epiphyses. This long cylindrical portion is called diaphysis. Long cylindrical portion of the bone is called diaphysis. Next question. Decreased PaCO2 and increased pH are marked in decreased PaCO2, carbon dioxide is decreasing, so it will be related to respiratory. And increased pH, if pH is increased, it will be alkalosis. So correct answer is respiratory alkalosis. Next question. A proteolytic enzyme secreted by chief cells in stomach. Proteolytic enzyme secreted by chief cells in stomach. Correct answer is pepsinogen. Pepsinogen is the proteolytic enzyme secreted by chief cells in the stomach. Next question. Chest percussion is contraindicated in clients with options: oxygen therapy, pneumonia, bleeding disorder, and COPD. Correct answer is bleeding disorder. In bleeding disorder, chest percussion is contraindicated. Next question. Which position is given to patient for postural drainage to drain apical section of upper lobes of lung? There is a confusion between Trendelenburg position and also Highfallow's position. Next question. Which of the following is a water soluble vitamin? Options: vitamin K, vitamin C, vitamin A, and vitamin D. Correct answer is vitamin C. Vitamin B and C are water soluble vitamins. ADEK, ADEK. These vitamins are fat soluble vitamins. The cranial nerve that arises from posterior aspect of brainstem that control the movement of the eyeball. These options: trochlear nerve, trigeminal nerve, optic nerve, and vagus nerve. Cranial nerve control movement of eyeball. That is trochlear nerve. Trochlear nerve. Next question. Wet form of beriberi characterized by involvement of options: heart, nerves, kidney, and brain. Wet form of beriberi characterized by involvement of, correct option is heart. Plasma protein called antibodies are options: fibrin, thrombin, albumins, gamma globulins. Correct answer is gamma globulins. Next question. Suture that unites two parietal bones to the occipital bone is, correct option, lambdoid suture. Lambdoid suture unite two parietal bones to the occipital bone. Suture that separate two parietal bones is sagittal suture. Next question. Which knot is used to tie a bandage around a wound to stop bleeding quickly? Correct option is reef knot or square knot. Next question. Moderately mentally retarded IQ is in the range of, correct option is 40 to 54. 40 to 54. Correct answer is 35 to 49, but here almost the value close to the 35 to 49 range is fourth option, 40 to 54. Next question. Which of the features or sign is always present in kwashiorkor? In kwashiorkor, there will be protein deficiency. If protein will be deficient, there will be marked feature is edema. So the correct answer is edema, first option. Next question. Which of the following is not correct in regard to potassium? First option, lower BP. It is correct. Potassium will lower the BP. Next option, human adult body contains 25 gram of potassium. It is not correct. It is the false option. It is vasoactive. Potassium is vasoactive. Next option, potassium is released by endothelial cells. It is also correct option. So the answer is human adult body contains 25 gram of potassium. Next question, sum of residual volume and expiratory reserve volume is options vital capacity, total lung capacity, functional residual capacity, inspiratory capacity. Correct answer is functional residual capacity. Next question, what is the first aid measure for a nosebleed? First option, sit the injured person down with the head forward and pinch soft part of the nose. It is the correct answer. First aid measure for nosebleed, sit the injured person down with head forward and pinch soft part of the nose. It will prevent more bleeding. Next question. A casualty down with multiple fractures during a disaster is triaged in green, black, red or yellow color. Correct option is red color. Next question, the perceptual process that select certain inputs for inclusion in our conscious experience or awareness at any given time is, for me the correct option is attention. A biologically important peptide for the maintenance of RBC structure. Options glutathione, enkephalins, oxytocin, vasopressin. Correct option is glutathione. Glutathione will help as an antioxidant, important peptide for the maintenance of RBC structure. Next question, who has founded concept of psychoanalysis? Correct answer is Sigmund Freud. Sigmund Freud founded the concept of psychoanalysis. Next question, Heimlich maneuver procedure is done in case of choking or foreign body aspiration. Next question, the region of the kidney that contain renal pyramids. Kidney have renal cortex outer and renal medulla inside. In renal medulla, the renal pyramids are containing. So the correct option is renal medulla. Next question, part of the brain that regulate posture and balance. Options pons, cerebrum, cerebellum, medulla. Correct option is cerebellum. Next question, rapidly adapting touch receptor is. Correct answer option 2, Meissner corpuscles. Meissner corpuscles are the rapidly adapting touch receptor. Meissner corpuscle. Next question, which of the vitamin is regarded as kidney hormone? Kidney hormone means hormones produced by kidney. Correct answer is vitamin D. Vitamin D is produced by kidney. Next question, fatty acids that cannot be synthesized by human body are called. Correct answer is essential fatty acids. Like essential amino acids, we are telling essential fatty acids. Essential fatty acids cannot be synthesized by human body, that have to be supplemented to the body. They have to be taken extra. Next question, digoxin or lavoxin, lanoxin, 0.125 mg is ordered. It is available in unit dose vial 500 microgram per 10 ml. How many ml does nurse administer? As we all know, the calculation, dose in hand divided by dose available into dilution. That means 1 mg equal to 1000 microgram. 1 mg equal to 1000 microgram. 1 mg equal to 1000 microgram. One mg equal to 1000 microgram. So 0.125 mg in microgram we can write 125 mg divided by 1000 into 1000. For making 125.125 mg into 2 microgram we can multiply by 1000. So 125. Dose in hand 125. Dose needed 125 divided by 500 microgram into 10. Then we will get answer 2.5 ml. Next question. Vermiform appendix is attached to options cecum, colon, duodenum, jejunum. Correct answer is cecum. Next question. Daily recommended intake of vitamin A for adult. Here confusion is rising. Recommended daily elements of vitamin A for women is 700 microgram and for men it is 900 microgram. Both these options are not given here. So we can either select 600 or 800. Exam authority will decide the answer. For men it is 700. For women it is 700 microgram recommended daily elements of vitamin A, and for men it is 900 microgram. Next question. A single rescue perform both artificial respiration and compression at the ratio of, correct answer is 30:2. Next question. 7 has a pH of, correct answer is 7.2 to 7.7. Which of the following indicate ventricular repolarization? Ventricular repolarization is indicated by T wave. T wave indicate ventricular repolarization. Next question. WHO defined how many moments of hand hygiene? There are 5 moments of hand hygiene. 3 after and 2 before. Before touching patient, before any aseptic procedure, after touching patient, after touching patient surroundings, after contact with blood or body fluids. There are 5 moments of hand hygiene. Next question. Which theory conceptualizes that the emotions result from our perception of changes taking place in the body during emotional experience? Correct answer is James Lange theory. There is a confusion between James Lange theory and Cannon-Bard theory. The examination team will decide the correct answer. Next question. Phallic stage of psychosexual development as per Sigmund Freud is 3 to 5 years of age, included in phallic stage of psychosexual development. Phallic stage of psychosexual development included in 3 to 5 years of age. Next question. Damage of which region of brain markedly impair understanding of speech and written language? Correct answer is Wernicke's area. Wernicke's area deals with understanding of speech and written language. Next question. Mechanism of ATP generation that links chemical reaction with pumping hydrogen ions is called? Correct answer is chemiosmosis. Chemiosmosis. Next question. Chamber of the heart with the thickest myocardium? Correct answer is left ventricle, because left ventricle puts pressure for pumping blood through the aorta to whole parts of the body. So heart layer of the heart with thickest myometrium is left ventricle. Next question. Stage of sleep important for cognitive restoration? Correct answer is REM. Third option is the correct answer. Next question. Foods of animal origin are the only source of which of the following? Correct answer is vitamin B12. In animals, vegetarians, there will be lack of vitamin B12. So, in animals only, vitamin B12 is present. Next question, which vitamin deficiencies cause conjunctival cirrhosis? Conjunctival cirrhosis is caused by options vitamin K, vitamin A, vitamin B, vitamin C. Correct answer is vitamin A. Next question. Protein contribute to total energy intake in the following proportion. Protein contribute to the total energy intake in the following proportion. Correct answer is 10 to 30%. 10 to 30% of total energy intake contributed by proteins. Next question. A nurse should lubricate length of catheter while doing female catheterization is options 10 to 12.5 cm, 9 to 10 cm, 12.5 to 17.5 cm, 2.5 to 5 cm. Correct answer is 2.5 to 5 cm. Next question. Lactose intolerance is caused by the deficiency of the enzyme. Options beta galactosidase, maltase, glucoamylase, sucrase. Correct answer is lactase. Other name of lactase is beta galactosidase. Beta galactosidase. It is also called lactase. Next question. Which of the following food is high in glycemic index 70% or more? Options potatoes, pasta food, cornflake, basmati rice. Correct answer is option 1, potato. Potato have 80 to 85% of glycemic index. Next question. Which of the following is a type of cognitive learning? Which of the following is a type of cognitive learning? Correct answer is options latent learning, avoidance learning, operant learning, classical conditioning. Correct option is classical conditioning. Next question. How you treat a casualty with foreign body in the nose? Options lay down and rest, that should be done. Make an attempt to remove the foreign body. No, without proper professionals, we do not attempt to remove the body, foreign body. Blow the nose. No. Next option is first option, maintain airway by asking the casualty to breathe from the nose. First, we should maintain airway. Maintenance of airway is the first priority. These are the 70 questions we have discussed in nursing portion.